Hey everybody. I hope you all had a wonderful spring break and welcome back. Okay. Give me 1 second. Here we go. So this week I have the perilymph fistulas. What is a perilymph fistula? It's an abnormal connection, tear, or defect in one or both of the membranes separating the middle and inner ears. It's a tear in the membrane, either the oval or the round window, which will cause perilymph, which is the fluid that fills the inner ear, to escape into the middle ear. And fluid exchange between the two parts of the ear can cause pressure change within the ear. So it can affect balance, and then obviously it can affect hearing. Some signs and symptoms: a feeling of fullness in the ear, sudden hearing loss, fluctuating hearing. So they might be experiencing hearing loss at some points, but then they're getting it back and then losing it again. So it's fluctuating. Dizziness, vertigo, nausea, memory loss, which I thought was really interesting, headaches, tinnitus, and a sense of imbalance, feeling constantly like the patient isn't balanced. And then the etiology and pathology. So like half of these cases are, I guess the causes aren't known, and it's not that nothing has caused it really, it's that a lot of the time the cause happens very a lot sooner than when the patient experiences the symptoms, so they don't really link the two. But for those patients who are able to locate a cause, the most common is head trauma or barotrauma, which is just trauma from pressure changes. So this would include like air travel, scuba diving, childbirth, lifting, heavy lifting. Barotrauma can also occur when blowing your nose. I guess that's called barotrauma with internal cause, and then like these other ones that I listed here are barotrauma with external cause. Some other things that could affect perilymph fistulas are whiplash, the tympanic membrane being punctured, exposure to really loud sounds really close to the ear, frequent and severe ear infections. I said blowing your nose with too much force. It is rare, but this has been shown to be present at birth in very, very few cases. And then there weren't like a whole ton of statistics on this, but I was able to find that the incidence is 1.5 per 100,000 in adults. And then it's up to 6% in children who have idiopathic sensorineural hearing loss. But it affects all genders and all age groups. As we saw from the causes, the etiologies, I mean, it's basically trauma. Trauma can happen to anybody. A head injury can happen to anyone. It's not like it's more common in one. And then, like every every gender, every age group gets on planes and blows their nose. These are all very common things that every person does, and so this doesn't really specifically affect one population over another. But the site of lesion is either the round window or the oval window, or in some cases it can be both. And then to diagnose, most often it's just using a variety of different tests and comparing the results from those tests. Tests will include hearing tests, balance tests, CT scans, MRI scans. And then this was a test that I had never heard about, the electrocochleography test. electrocochleography test. And this helps the doctor to examine the fluid in the inner ear and determine if it is irregular. And then there's a perilymph fistula test, and this tracks a patient's eye movements while pressure is applied to the external auditory canal. And so, hold on, if I can, oopsies. I was gonna put my camera on, but it's okay. But basically, if you like put your finger to your external auditory canal and you like kind of plug it and you apply pressure, patients who are experiencing perilymph fistula, I guess the pressure causes their eyes to rapidly move. Into this test, like if they have rapid eye movement with the pressure, then it's a an indication that they have perilymph fistula. So I thought that was really cool. And then also it can be found through surgical exploration. That's not as common, but and that can help to diagnose. And then treatment and management. A lot of doctors recommend bed rest or restricted activities, so like not heavy lifting, for like not traveling and trying to avoid environments where there is pressure changes for 1 to 2 weeks, and hopefully like they hope that it can heal on its own. But there are some other options, and this one was really cool, the blood patch injection. And basically this is when an audiologist will inject the person's own blood into their middle ear, and the blood somehow patches the tear in the membrane of the window, and so that kind of like the blood helps to repair the damage in the ear. And then there's also a surgery. The TM is lifted through the canal and tissue grafts are placed over the membranes in the middle and near ears. And then I have a video. This video is about a patient who had experienced this, and she had lived for like 2 years without knowing what was causing all of her symptoms. So it was really cool. And then it's kind of like a documentary tracks, it's really short, don't worry, but it like tracks her treatment and her, oh, what is that word, like recovery after she gets the surgery. And you can completely tell like how debilitating this was on her life with the first video we're about to, like the first clip that we're about to see, and just how much the surgery and getting this treated really helped her and improved her quality of life.
So I've been going through this for the last year and a half, and it's progressively getting worse. And I've had 2 shunt surgeries, care of headaches and everything. And the first one didn't take, and the second one kind of took, and I started getting headaches back again. So I came to see Dr. Wackham, and the dizziness is just insane. It's hard to walk from point A to point B without being extremely dizzy. My ears constantly ringing and throbbing, and my eyes hurt. It's hard to concentrate on, and I forget what I'm always talking about. So whenever I hear loud sounds, I get really nauseous and even more dizzy, and I can't concentrate. I can hear my eyes move. My eyes are hard to focus on things. Okay, so today is the day after surgery, and I feel $100 better, $1,000,000 at that. I'm not light sensitive anymore, and the window shade's actually open. I'm not dizzy. The only thing is, the ear feels full, which is to be normal. I can remember a lot more for the most part. Let's see. I'm not light sensitive anymore, and my headaches are gone, and the dizziness is gone. So huge improvement. It'll be nice when the fullness goes away, but other than that, I feel 100 times better. And before the surgery, I could actually hear my eyes move, and I no longer can. And I am no longer nauseous and dizzy. Okay, so today is about 5 weeks after my surgery, and I feel great. I do not hear my eyes moving. I do not have any headaches. My life, I feel like, is getting back on track slowly but surely. I know I still got to get somewhat easy because I don't want to overdo it and injure myself, but all in all, I do feel better. And I don't have the ringiness either in my ear. My cognitive is slowly getting better. I would say it's a lot better than from a few weeks ago, even though I can't remember everything, but it's gotten better. So it's been 3 months since my PLF surgery, and I feel amazing. Best I've felt in 2 years. I no longer hear my eyes move or my heartbeat in my ears. I am back to work after 2 years, which is pretty amazing. My thinking is better. It's working on it, and I'm doing great. I feel good.
Yeah, so I thought it was just really cool to see. And it just reminds me that, we really do treat patients to improve their qualities of life. And this individual patient, getting that diagnosis finally after a year and a half of having the symptoms, and then being able to be treated for it, and coming out after the treatment, and you just see the progress that she's making week after week after week, and how much better she is able to live her life and enjoy her life. So I don't know. I really like that video, but yeah, let me just show you my references real fast. Yay. Here they are. Okay. I hope you guys have a great week, and I'll talk to you soon. Hey.